Hi, and welcome to Student Nurses Success. Today we're going to cover cellular injury. This video actually goes well with my video on neoplasia cancer, so we'll do this in a two-part video series. This first part one video is going to cover cellular injury and adaptation, and part two will cover some of the basics of neoplasia and cancer. As always, the link to the blank and completed concept maps can be found in the comments section. So let's begin with some information on cellular injury and adaptation. Here is our completed map, and yours should look close to this at the end of the video. Here's our blank map so that you can follow along. Let's start in the center here. When cells are injured, they respond three different ways. They can respond to an injury and they can completely reverse and heal. They can adapt to the injury, and that is also reversible. Once they adapt, they can actually revert back to their normal cell, or they can respond irreversibly, in which they will die. So, with mild injuries, this is what we have with reversible injury. With a mild injury, cells can actually withstand this pretty well. With a mild injury, the cell might start to swell a bit and have some inflammation in response to that injury. Most of that is due to the fact that the sodium potassium pump actually shuts down when the cell is injured. And when that sodium potassium pump shuts down, there's actually accumulation of substances in the cell. However, all of this is short term. And if the injury is mild, it all becomes reversible and the cell starts back up again. And no damage has been done. Now, in some cases, cells undergo repeated injury or assaults, and in these particular cases, it'll start to learn how to adapt. A great example of this is in a smoker. The constant nicotine will actually start to irritate the delicate lung cells. Or if you have a lot of acid reflux, the constant stomach acid on the esophageal cells will cause irritation of those cells. In both of these cases, cells will actually learn to adapt. And they'll actually change a bit so that they're better able to handle this irritation. Now, when they adapt, they actually will do the same function. However, they are a little different. They're a little changed. If you remove whatever's causing the injury, maybe you stop smoking, the actual cells will go back to normal again. So this adaptation piece can be completely reversible. Now, the third response to injury is what we call irreversible injury. And if it's irreversible, that means the trauma is so bad that it kills the cells. So we're not talking about a mild irritant, but we're actually talking about trauma so bad that it causes the cell to die. This cell death from this prolonged injury leads to what we call necrosis or apoptosis. And those are the two types of cell death. And if you can look over here, we're actually going to talk about those in just a moment. So in Step two of the response to injury, I talked a little bit about adaptation. And so here are some different ways that cells can actually adapt. There's five different: atrophy, hypertrophy, hyperplasia, metaplasia, and dysplasia. Now, atrophy means that the cells shrink and reduce in function. So if you don't use something, it gets smaller. If you don't lift weights or you don't work out, your muscles will get smaller. It's a way your body kind of conserves energy. Cells can also get bigger in size. We call this hypertrophy. And when we have hypertrophy, the cell's size will actually increase in size and increase in function. Now, hyperplasia is an increased number of cells. So that'll actually also increase its function. Often, hypertrophy and hyperplasia go together. When you start to increase usage of something, the muscle builds, for example. It may build in both size and in number. Now, metaplasia is actually the one that's really interesting, and that's what we talked about in number two, adaptation on the cellular injury over here. This is actually metaplasia. What happens in metaplasia is you actually replace one cell type with another cell type that's better suited. It will actually do the same function, but it is a little different. So, in the example of the smoker, the lung cells that are very delicate will be replaced with something a little tougher, but they'll still do the same function. They're just changed a little bit. The last adaptation is called dysplasia. Now, dysplasia, you see this dys, that never means anything good in medicine, is actually disorganized, abnormal cells. So in this particular case, it's actually one beyond metaplasia. And what we have is a disorganized cell that's abnormal in cell appearance and in function. Well, and we can all guess what this actually ends up leading to. It has a significant potential to actually turn to cancer. We actually even call it often cancer in situ, meaning that if the cell is dysplastic, it's actually just really on its way to being cancerous. So dysplasia is not a good thing. And sometimes metaplasia, if you've changed to metaplasia, even though that's still a good functioning cell, it's already made one change, and there's nothing really stopping it from making another change down to dysplasia. Now, I also mentioned that irreversible cell injury can lead to cellular death. And there's two types of cellular death: apoptosis and necrosis. Now, apoptosis is actually programmed cell death. And a lot of times we actually call it cell suicide. With cellular suicide, the cell has made a decision to go ahead and go away. And it's a very calm, quiet process. Let's say the cell is old and worn out, just can't function anymore. It's just time for it to go away. And so it apoptoses and it just almost kind of envelops itself and disappears. It's very quiet. There's no drama, there's no inflammatory response. It's all very straightforward and quiet. This happens when cells are old or damaged. In fact, your body really, if you have a cell that's mutated or become damaged, your body really should just take care of it. We have these that happen all the time. A cell mutates and your body decides, oh, that's not a good one. And it just quietly apoptoses it away and takes care of it. And so this is a good normal response. Now, at the other end, we have necrosis, which is very traumatic. With necrosis, there's some type of critical event that occurred. And that critical event actually disrupted the cell membrane. In this particular case, the cell dies but causes a big inflammatory response. And that response is systemic throughout our whole body. We'll see fever develop. We see maybe malaise, not feeling well. And really, what happens is we can actually even detect proteins in the blood. These are inflammatory proteins or inflammatory responsive. One of them is a sedimentation rate. And so we can actually start drawing lab values that shows that we've had a big event happen and a big bunch of cells died or are dying. So it's very dramatic. Now, gangrene is actually when a considerable amount of necrosis has occurred. And that's when we call gangrene. And you can see a little picture there of the hand. So maybe you're starting to wonder what causes cells to either change or die or have these injuries. Well, certainly the number one cause is hypoxic injury or what we call ischemia. And that's when the cell is deprived of oxygen. And the longer it's deprived of oxygen, the more damage. If it's deprived for just a tiny bit of time and it's a mild injury, we actually might see reversible. But if it's a long period of time, then the cell's going to necrose and die. So, hypoxic injury we see a lot when blood supply is cut off to an area. We see this a lot in a heart attack, where blood supply is cut off to the heart muscle and the heart muscle starts to die. We also know that physical agents, some like maybe chemicals, can be caustic and damage cells. Maybe there can be mechanical agents, rubbing, or maybe some kind of mechanical agent that puts pressure on and causes damage, or thermal injury like burns can cause damage. We know that radiation can cause damage. We have ionizing radiation or non ionizing or even radiant. Other chemicals can be actually drugs, maybe metal toxicities that are toxic to the body or to cells. Biological agents are usually things like bacteria can cause cellular injury, viruses can cause cellular injury, even a parasite. And then nutritional imbalances. Either too much, we know that obesity can cause cellular injury, or too little nutrients, both of those. Now, we also do know that cells age over time, and as cells age, there's a progressive decline in them. And that progressive decline is in their function and their ability to repair themselves. Cells that are aged should go through apoptosis. Wear and tear is just normal for a body, and cells that are aged and apoptose should really go through that quiet death, not cause any inflammation or systemic response. Now, we also know that cells have what we call telomeres on them, and telomeres are actually caps on the ends of chromosomes. So you can see in this picture here, these telomeres actually are protective and they should protect that chromosome. However, they do wear out over time, and as they wear out, they wear down. And so those telomeres become damaged. They become damaged with age, with injury, with illness. So if you have a lot of chronic illness, your telomeres are getting worn out probably a little quicker than they should be. But in general, cells do get older and they decrease in function, and they also decrease in their reserve and their ability to function. And that's just normal. It's just the effect of wear and tear of life. And so there you go. This is a pretty good overview of cellular injury, adaptation, and cell death. And as I alluded to, sometimes cells change into a cancerous form. So please watch the neoplasia cancer video, which is really the second part to this discussion. So I'll see you in part two, and remember to subscribe to the YouTube channel so you can find all our videos and earn that A+ in pathophysiology.